right, let's move on to the last presenter. Dr. Corey Nagel, Assistant Professor, Department of Nursing Research, University of Arkansas for Medical Sciences.
Hey, y'all, so I am standing between you and the reception and drinks, and we're running behind, so I will try to move through this fairly quickly. So my talk is on using machine learning, specifically random survival forests, to examine predictors of dementia risk in the health and retirement setting. Dr. Power's talk is, I've actually been a great fan of your work this past, and we discovered it a couple months ago. And it has relevance to this because we're using Langolier for this, but I'm actually excited to talk to you. Thanks. So introduction slide, I mean, this basically, introduction slide, I mean, this basically kind of says what we all know. There's substantial heterogeneity and trajectories of cognitive function among older adults, and we see persistent racial and ethnic disparities in both the onset of dementia and dementia risk. We've seen that in our work consistently. And what we can assume is that these racial and ethnic disparities are likely the result of fairly complex factors coming together: early life factors, healthcare related factors, sociodemographic factors. And to move health disparities research forward, it's important that we begin to elucidate those and identify those kind of complex interactions that give rise to racial and ethnic disparities in dementia risk. So machine learning methods can provide a complement to hypothesis-driven approaches, because those hypothesis-driven approaches require a priori specification of relationships of interest. And, you know, we don't always know what the important relationships are, so that we can specify them, let's say, in a regression model. Is this on? Yeah. Machine learning methods are non-parametric, typically, robust to high-dimensional data, which relates back to one of the comments earlier about the growing amounts of health-related data that we have, and the need to develop and utilize methods that are appropriate to analyzing those data. And importantly, many of these methods are able to model complex and nonlinear relationships. Now, these have been used, you know, for quite some time in relation to prediction problems, right? They tend to be fairly good methods for predicting outcomes. However, their use in inference has been limited because many of these approaches are fairly archaic. You can put a bunch of data in as an input, you get a prediction out. That prediction is often quite accurate, and we have very little idea of how the model arrived at that prediction. Many of them are essentially black boxes. However, in recent years, there's been a growing momentum toward what's called interpretable machine learning. Basically, the development of approaches that allow us to look in the black box and make determinations about how these approaches are actually making their predictions. This has been driven in part, you know, by a number of things, but one of the issues is assessing the issue of racial and ethnic bias in these models. If we're predicting, let's say, recidivism from incarcerated individuals, we need to understand the degree to which things like race and ethnicity are driving the prediction because they have real world consequences. So the methods that fall under the rubric. Okay. So the methods that fall under the rubric of IML allow us to use machine learning and powerful tools for inference as well as prediction. And another important development in machine learning is the development of longitudinal methods. This is an area that I've been interested in for a number of years, and it's really been in the past several years that there's been kind of robust and growing development in developing machine learning approaches that can be applied to the kind of longitudinal data that we typically use in health sciences. So this analysis employs random competing risk survival forests, which is a machine learning approach, random forest using competing risk survival trees, and IML techniques to identify important predictors of time to dementia onset and quantify their effects using what are called partial dependence plots among diverse racial and ethnic older adults using data from the health and retirement study. And so we used publicly available data from the health and retirement study. We're all familiar with that, I think, at this point. We included all respondents aged 65 to 67 who were not cognitively impaired at baseline and contributed greater than 2 waves of data between 1998 and 2018. And we restricted our sample to such a limited age range because when you include all ages, age basically becomes the most important predictor in the data for both mortality and dementia. So in order to kind of keep that predictor from just washing out the effects or being the kind of dominant predictor in our data, we wanted to just have a very tight age range. Our total sample was 13,036 persons with a median of 10 years of follow-up time. And as I mentioned, we used the Langevin algorithm to identify dementia. We didn't include CIND or cognitive impaired, not dementia, because we've seen kind of a pretty low, there's a lot of kind of temporal fluctuation in that SIND categorization, but dementia seems at least a relatively stable categorization. In this model, we included a total of 33 potential baseline sociodemographic, health-related, and early life predictors of dementia risk. And there's a whole list of them here. Those included things like sex, race and ethnicity, nativity, educational attainment, Medicare recipient, poverty status, coupled status, census region of residence, as well as number and type of chronic conditions, depressive symptoms, mental health conditions, alcohol use, tobacco use, recent falls, BMI, and then several early life indicators such as early life poverty, early life poor self-rated health, highest parental education, and birth in Southern census region in order to get at some of the work that has been, has examined particularly how the intersection of educational attainment and growing up in the segregated South intersect to drive observed disparities. So in terms of just kind of the kind of steps in the analysis, we first examined unadjusted survival curves for competing risks of dementia onset or death by racial and ethnic group. Because we had some missing data on our predictors, we imputed that data using the MIS forest algorithm, which is a random forest-based algorithm that is a single imputation method. We then included all candidate predictors in a competing risk random survival forest, predicting the competing risk of dementia onset or death. We calculated the decrease in permutation accuracy to rank candidate predictors on their relative importance. We then calculated partial dependence to estimate the marginal effects of top-ranked predictors, as well as examine marginal effects conditional on racial and ethnic group membership. And then lastly, we repeated step 2 in a stratified analysis to examine differences in importance rankings across racial and ethnic groups. And I'll talk a little bit more about these methods as I go on. So random forest is based on trees. A forest is just a collection of trees. And so a random survival forest is a collection of survival trees. Let me just kind of stick to a diagram of a tree. So this is a survival tree. Bit on our data. The basic idea in a survival tree is that you partition the data space in order to result in, at the very beginning, 2 groups that are homogeneous within group, heterogeneous across groups, on the basis of the outcome of interest. In a survival tree, that outcome of interest is, and this one is dementia-free survival. And so you can see here the top node, what's called the root of the tree, is education. So education, every variable in the predictor space is assessed, and every possible split is assessed in the algorithm. And so the best variable at the best split is the one that can kind of most separate the two nodes. So that's done in the first case, that's education category. So you essentially can view education category as being the strongest predictor of survival outcomes. And then a second split is made, and so on and so forth. Variables can split again and again, so it's not like one variable gets used and then thrown away. You can see here that education, some of these variables occur multiple times. So We first split on education category, and that splits between less than high school and high school grad and college. It then splits less than high school by race and ethnicity, and splits high school grad and college by self-rated health. And then self-rated health, excellent as good, is split again by race and ethnicity. The nodes at the bottom indicate dementia-free survival probabilities. And so you can see that the kind of lowest dementia-free survival rate is less than high school non-Hispanic Black. There's two splits that are made on education and race and ethnicity, and that's the lowest. The highest in this tree is high school grad or college, excellent or good self-rated health, white or Hispanic, race and ethnicity, and then in the top two quartiles of wealth ends up with the highest rate of dementia-free survival. Now, this tree, typically in a survival tree, the tree is grown until some stopping criteria are met. In this, because I just wanted to show this for the purposes of illustration, I just set an arbitrary stopping criteria of 4. So the issue with single tree-based methods is that they're prone to overfitting. And so a number of approaches have been developed over the years to address this. Random forest is one of those. And so the random forest algorithm is basically rooted in the idea of growing an ensemble of trees, a forest of trees, and then averaging predictions over the trees in that forest. So the algorithm is first draw a bootstrap sample from the sample data, and that's a bootstrap sample with replacement. Fit a tree to the bootstrap sample, splitting at each node of the tree using a randomly drawn subsample of the candidate predictors. Evaluate the model error using cases not included in the bootstrap sample. This is known as out-of-bag error, and then repeat and average the predictions across all of the trees. So the competing risk random survival forest was developed by Ishwaran in 2014, and the split criterion for a competing risk survival forest is the generalized log rank test. And that's based on the weighted differences in Nelson-Allen event-specific cumulative event hazards. And then for reporting outcomes, we chose to use the cumulative incidence function calculated using the Allen-Johnson estimator. We calculated, as I mentioned, variable importance using permutation decrease in accuracy. And what permutation decrease in accuracy means is that you randomly permute one of the variables in every tree in the forest. And then you calculate the change in accuracy that results from permuting that variable. Randomly permuting it basically breaks any possible association between that variable and the outcome. And so the variable that has the largest decrease in accuracy when it's randomly permuted is considered to be the most important variable. So that's one measure of variable importance. There are a number of others. You can count the number of times a variable is at the roots. You can average across the position of the variables in all the trees, but we use permutation decrease in accuracy. And then the partial dependence plots show the marginal effect of selected predictors on the model predicted outcomes. And this is a real advance in random forest because we've been using these for a number of years for variable selection. And what we would typically do is run a random forest model with a bunch of predictors. And then the random forest would give us a variable importance plot that would show us the top ranked predictors. And then we would put those into some kind of generalized linear model in order to be able to estimate, well, what is the actual effect of these variables on the outcome? Because the variable importance plot doesn't tell you much other than that these are important predictors. The development of methods like partial dependence plots actually allow us to get predictions from our random forest that are very similar to those that we would get from a regression model, albeit with an approach that is robust to nonlinearity, that contains interactions that occur in the data, et cetera. So these are just this is the cumulative incidence of dementia by race and ethnic group. These are just basic survival curves. We can see here that white is red and Black and Hispanic are green and blue respectively. And so you can see that there's a marked difference between the cumulative incidence of dementia between whites and both non-Hispanic, Black, and Hispanic individuals. And again, this is something that we've seen over and over again in multiple contexts. Oh, and here's just some estimates of that cumulative incidence. We can see at 10 years. Among non-Hispanic whites, it's 7.6, non-Hispanic Black, it's 22, and Hispanic, it's 21. At 20 years, it's 20% among non-Hispanic white and 41% and 45% among non-Hispanic Black and Hispanic, respectively. We can see that the cumulative incidence of death, again, this is just an unadjusted basic competing risk survival model, doesn't differ all that much. And in fact, non-Hispanic white have the highest cumulative incidence of death. But keep in mind that this is a competing risk model. So once somebody enters into the dementia state, they're no longer in that's considered an absorbing state in a competing risk model. So that's likely driving a bit of this. So these are variable importance plots from our competing risk random survival forest. And we can see here that the variables that are important predictors of dementia in the total sample differ considerably from those that are important predictors of death. So for dementia, the most important predictors, these are the ones that have the biggest bars. Education is the top predictor of dementia risk, followed by race and ethnicity, stroke, a history of stroke, household poverty, and visual impairments. Those are the top 5 for dementia. For death, we can see that the predictors are much more closely aligned with typical medical conditions. Self-rated health, for example, is the top predictor, followed by current smoking, multimorbidity, or having multiple chronic conditions, lung disease, and diabetes are the top predictors of death. So this is a partial dependence plot. So this is the marginal effect of education on dementia risk, on cumulative incidence of dementia, after accounting for, controlling, marginalizing over all of the other predictors in the data, all the other 33 or so predictors. Again, this is kind of, you can interpret this analogous to the way that you would interpret a marginal effect from a regression model. And so we can see here that there are marked differences in dementia risk by educational attainment. And those tend to be with less than high school. We can see about a 30% cumulative incidence of dementia at the end of the 20-year period versus roughly a 20% incidence in college. And there's not too much of a difference between high school graduate and college graduate. We can see here, we also see pretty substantive differences by race and ethnicity. Again, this is after controlling for or accounting for the effect of education, wealth, poverty, early childhood factors, comorbidities, all of that. We can see that on average, at 10 years, non-Hispanic whites have about 10% cumulative incidence, whereas non-Hispanic Black have about roughly 17. And we can see that these differences persist across the observation period. Again, they're attenuated somewhat when we compare them to the raw estimates, but they're definitely not attenuated away. And then these are stroke history. This is not a surprise, given that we know that stroke is associated with dementia risk, but this is stroke at baseline. And we can see even reporting a stroke at baseline in the HRS is associated with a higher incidence of dementia at 20-year follow-up. And lastly, we can see that household poverty, again, this is the 4th highest predictor of dementia risk. Households that report or actually report an income that falls below poverty thresholds have a greater incidence of dementia risk. And then lastly, this is variable importance stratified by race. And we can see that there are actually differences in the variables that are important by racial and ethnic groups. So this is the same model, but run within the different racial and ethnic groups. We can see, first off, although education is the top ranked predictor for both non-Hispanic white and non-Hispanic Black, its importance relative to the other predictors in the model is much greater among non-Hispanic Black respondents. We then see among non-Hispanic Black, the 2nd and 3rd most important predictors are self-rated health and, interestingly, early life self-rated health. So individuals who report poor early life self-rated health have a higher risk of dementia among non-Hispanic Black respondents, but that variable actually has very little impact among non-Hispanic White. I know I could talk more about this, but we are already behind time. So in summary, accounting for competing risk of death, cognitively intact non-Hispanic Black and Hispanic adults had increased risk of dementia onset over 20 years of follow-up compared with non-Hispanic Whites. Again, that's not anything new. In competing risk random forest survival models, including a range of sociodemographic, health-related, and early life predictors, these differences were somewhat attenuated but remain substantial. Among the total sample, the strongest predictors of dementia risk were educational attainment, race and ethnicity, baseline history of stroke, household poverty, and visual impairment. In contrast, the most important predictors of mortality were poor self-rated health, stroke, multiple chronic conditions, lung disease, and diabetes. These findings highlight the importance of social determinants as substantial contributors to the risk of cognitive decline among U.S. older adults. And the study illustrates the utility of data-driven approaches such as random forest to identify important predictors in the context of large numbers of statistically significant associations. Any questions?
So on your last plot for race-specific importances, you have different scale, right?
Yeah, that's a great question.
And it
I think I know
means
where you're
that we have, if it would be the same scale, yeah, we have all variables similar and very, very important. Could you please show?
Yeah.
Yeah, and the first variable, this is education, yeah. It's very, very important for Black population, and all other variables are similar between them, right? If to correct for the same scale, approximately. Yeah.
Yeah, I mean, you get to a good point, which is that the actual metric of variable importance is not particularly interpretable, so it's basically a relative metric. If you look at any of the reading on random forest and variable importance metrics, it's
relative between variables or between races?
Relative between variables. So the position and the magnitude relative to other variables is comparable. So we can say, for example, that this difference here that we see, this kind of educational attainment is kind of has a much higher variable importance in this model among non-Hispanic Blacks than it does here. That's an important distinction, right? Because this indicates that from using this variable basically in this stratified analysis resulted in a marked decrease in the model's accuracy relative to what it did here. But you can't compare the magnitude across the stratified model. That doesn't work. Does that make sense? Yeah.
Did you normalize the data sort of within each category so they're all on the same scale? So then you could compare the relative.
No. So in random forest, unlike other approaches like support vector machine or some others, random forest does a pretty good job of handling mixed data types. So you can have continuous data, ordinal data, categorical data. One of the issues with random forest, and it's a known issue, is that it tends to be overly sensitive to data where there's lots of potential split points. So even though it's a method that doesn't require data normalization, if you have if you have age as a continuous variable, and then you have a bunch of dichotomous indicators, it's gonna sort of prefer to select age. Because of that, all of these are categorical. So essentially what we did is categorize even our continuous measures, tried to reduce them down to a relatively parsimonious number of categories. There's an approach called conditional inference forest, which is very similar to random forest and that addresses the issue of this kind of over preference of continuous and categorical indicators with a large number of categories. But this particular method of competing risk survival forest hasn't been developed in the conditional inference framework yet. A lot of this stuff, which you'll find that, especially with a lot of these longitudinal methods, is that it's advancing very, very quickly. So even in the past couple of years, there's been work on things like mixed effects survival analysis and or mixed effects land forests and things like that. Discrete time. There's some recent work in allowing for the introduction of time varying covariates into survival forests and into discrete time survival forests. Again, kind of very recent work in the last couple of years.
Yeah, sure. This is a non-technical question. If I heard you correctly, you said even after factoring in all the important social determinants in your outline part of the education. But I heard you say it attenuates but does not attenuate away the differences between
Yes.
black, non-Hispanic blacks and whites.
Yes. So if we take the PDP as essentially a marginal effect, we can see that the marginal effects are smaller than the unadjusted effects, but they're still there.
Which leads to my question. What then could be explaining? Are we invoking genetics? Are we invoking other biological factors that we are clearly saying, other than all this, there's something intrinsically different about these two groups in terms of dementia risk. I don't want to put words into your mouth. I know it's tricky, but I'm just trying to interpret what you said in a clinical kind of context.
That's a great question. I think it's for me at least the $1 million question. I tend to think, if you're asking my own personal opinion, I tend to think that it's a combination of one, coarseness in our covariate measures. So for example, and there's been some really interesting work over the past couple of years that looked at this. When we talk about controlling for education, right? We create this education category that's like less than high school, college or greater. With little reference to educational quality, what that means, what that refers to, how that differs markedly in different contexts, right? So, but then we sort of convince ourselves that, oh, we've controlled for education, when in fact we've controlled for this very coarse indicator that doesn't capture all of the variation within those categories. So that's part of it, I think. A second part of it, and it's one actually with the reason that I mentioned the presentation earlier, is it's known that the Langolier is overly sensitive to dementia categorization among both non-Hispanic Black and Hispanic subgroups. So I'm interested in rerunning this analysis using actually the modified herd algorithm.
Thank you.
Yeah.
There is one question in the Q&A section online.
Yeah.
I'm just gonna read it off. Tongtan Chantara asks, in the overall model, not stratified by race, it looks like race is more important predictor of dementia than birth in the South, probably a proxy for racism. Does this finding contradict with race is not a predictor of health? Racism is.
It's a good question. Yeah, I don't know how to answer that.
So look, it means what's more important to be black, for example, or to live in states
Right.
of stroke belt, for example.
Well, I mean, one thing that we can do is look at the relative ranking within the stratified analyses to see if being born in the South is also an important predictor among non-Hispanic whites. I mean, that would be one way to address that question. And we see, in fact, that it's not a, it's ranking, it's kind of got a little bit of whoops. We can see the position here for being born in the South is kind of here relative to here. So it looks like it has perhaps a higher ranking, although, we're getting down into the territory in kind of both of these models where you've got a bunch of predictors that are really vying for importance. I wouldn't say that one is particularly greater than the other. The thing to do, and this is another kind of useful approach in calculating partial dependence in random forest, is we can look at the marginal effect of being born in the South, conditional on being in the different racial and ethnic groups. And that would actually give us a sense of whether kind of there's a greater impact on dementia risk among non-Hispanic Blacks who were born in the South than non-Hispanic whites who were born in the South.
So in one of the previous talks, religiosity or spirituality months apart in at least parsing out these two. Now, in terms of what you just described doing in the South, did you look at folks on the areas of the Bible Belt, which was apparently more religious in terms of that?
No, that's an interesting point, because it would be in the HRS, they actually have census region, I think. There's actually a more finer grained distinction where you could separate out that kind of mid-south region from Texas, Oklahoma, and then the, you know, the kind of eastern seaboard. Yeah.
Would the importance be changed when the tree will be combined with the time events for each of the variables?
That's a good question. So the variable importance is not, because that's taking into account in the calculation of variable importance, and we could talk the math of it later. The different estimates, the different time points. I will say that's why, but with partial dependence plots, that's why partial dependence, or the marginal effect, has to be calculated separately at each time point. So I, like in these plots, I just arbitrarily chose 2 years, 6 years, 10 years, and 20 years.
There was another. Sorry.
Did you try to combine with causal relationship between the variables? I mean, the trees, and combine how they are?
No.
More question online, was the survey, were the survey weights accounted for in this research?
No, and that's a great question. That's another area of kind of ongoing, and to me, too slow development in the machine learning field, because all of my work has been, you know, basically for the last decade working with the HRS and the NHATs. And most of these methods can at best crudely account for things like survey rates. And I've seen very little interest or development in the use of machine learning for complex sample design. So if anybody wants to take that on and start developing these methods, it would be fantastic. You can account for population weights, but then you run into the issue is, as soon as we start selecting respondents from the full HRS sample, we then actually have to recalculate the weights, and so it is an issue.
We did a little of that, and one of the other issues with an HRS size sample is that the seed you set matters. You'll get different answers with every different seed. So it's just the size of the data set also really constrains the power of these algorithms.
Yeah, and what I've done in this, and what we have tended to do in our machine learning similarly, is choose some different seed values and like see, do things get crazily different, and if so, that's a problem, right? But because I know you use Superlearner and Lasso and a number of other things in your paper. So
Thank you, everyone, for attending, and don't forget about the reception afterwards.